Poultry Industry Council, and I'm glad to have everyone joining us for the Small Flock Ontario webinar focused on municipal bylaw officers. Today's event is one that is very targeted to information, but we hope to share as much as we can with you. I thank you all for signing on time, and this presentation is recorded, so at any time at the end, if you had questions or needed to re-see, we will post it to our website shortly. Just to get us kicked off, we will begin with a brief introduction and let you know what the plans are as we move through. So today's presentation is, again, specifically for our bylaw officers and to help you guys know what you're getting into and how you might expect to move through. Very quickly, we do have some extra special speakers with us today. I've already introduced myself, but we will also be hearing from Canadian Wildlife Bird Health Cooperative, Dr. Brian Stevens. As well, we have the Ministry of Health representative, Dr. Heather McClinchey, and from the municipality of Georgina, Mike Hutchinson. Over to the right, you can see the agenda where we look forward to enjoying Small Flock Ontario information update from me, as well as sick bird monitoring and reporting from Dr. Brian Stevens, zoonotic disease from Dr. McClinchey, and then Small Flock's big success in Georgina. We will have live Q&A at the end. I encourage you to use that bottom tab and drop your questions in as they occur. You don't have to wait until the end, but we will hold all questions to the end and panel them with our experts. Again, thank you all for joining us. If you've logged in and you can find that raise your hand symbol, I invite you to make sure that you engage and participate. Type your questions as you go. And I'll ask a quick question. Does your municipality already allow backyard chickens? So again, you can use that raise of hand to let us know that you are in that group. We've got some hands flooding in. Excellent. So some people already engaged with small flock owners. Our next question for you is, do you allow broilers like meat birds or layers, or maybe a combination of both? My most meaningful question is, do you have educational materials to share? So this one is sort of a segue into what we do here at Poultry Industry Council. Before I move too far, I will mention that the funding for this project was supported through the Sustainable Canadian Agricultural Partnership, PIC ourselves, as well as the Ministry of Ontario and the Federal Government of Canada. So you might be asking yourself, why poultry industry? What do we do and how do we do it? In the Small Flock Ontario project, it is a little outside of our normal scope being industry. However, once upon a time, the city of Guelph invited us to train some people on how to properly raise backyard chickens. We started a long time ago, and we've continued offering that information. The key there was accurate information from experts who know. And being non-commercial flock owners, we welcomed them to the commercial flock information. It's continued to grow annually, and during COVID, we switched to being virtual instead of just in the city of Guelph, which is where not only did I meet my good friend Mike, but also we've had a much further reach. As we continued through and there was a little issue with some high-path avian influenza breaking out, it was time to do a little more meaningful and build a small network of people so that everyone, whether they were chickens or pigeons or emus or ducks, everyone had access to information and they would know how it was going. As you can see from my little map in the bottom, the reach here continued to grow week after week. At that point, Small Flock Ontario was born. We continued offering not only webinars twice a week, but also building a learning hub with more tailored resources that are available for you all around the time. The process aligned very well with what PIC does during our day job, and ever since its inception, the Small Flock Ontario has continued to support. PIC, in both aspects, industry as well as small flock, we're committed to education, information sharing, moving that information, and bringing people together. We've worked to build a community through online training, web resources, as well as a robust website with references. As you can see, there's much more there, but we also attend and organize events. Our website is very simple, smallflockontario.ca. You likely had to click on it when you were registering for this event. However, I encourage you to take some time and click around. There's always more to learn. We did start focused on avian influenza because that was sort of a crisis at the time. However, we do look forward to including more material. Now, unlike some websites, ours was created and reviewed by experts, not only CFIA, OMAFA, veterinarians, but also industry representatives, because the disease was serious and people needed clear information they could trust. A lot of our resources were aimed to be hung up in someone's household or posted in a store. So the resources are very visual, and we tried to make them straightforward to see when you should be reaching out for further help. It turns out that when you go into the field, there's a few questions that you might be asked over and over and over again. So we built a frequently asked questions, and it continues to grow. If you have frequently asked questions, feel free to let us know. We can source the answer from experts and post it there as well. Now, the materials we printed were a small batch. However, on our website, you can download these materials. You might want to print them and bring them or read them over before you arrive at an inspection or visiting with a small flock owner. In the event that they're not so much with the booklet, but would rather watch a small video, we do have tons of those, and they range from a 2-minute how to do a safe biosecure entry right up to a 2-hour webinar. In order to stay informed, I encourage you to offer this resource or signing up to the people that you visit with small flocks so they can stay informed about disease outbreaks as well as helpful information. In the event that there was an affected premise, the Small Flock Ontario did cover that. We trained caseworkers across the province to navigate the process of moving from an infected premise into a released area. So they advocate on behalf of the owner. They work directly with CFIA to make sure the paperwork and the process is handled as quickly and smoothly as possible. Their offering is just that. It's offered through a CFI agent who is managing the premise. It is a direct offer. They would never approach a small flock owner under any circumstance without that information. Now, without further ado, it is time to move forward and hear from some of our experts. And the first expert that I am going to introduce is Dr. Brian Stevens from the Canadian Wildlife Health Cooperative, here to talk about wild bird disease and reporting. Thanks for joining us, Brian.
Thank you, Charlotte. So let me just pull this up. Okay. I do apologize in advance. I do have some work being done on my house, so if you hear some background noise, that's what's going on. So today I'm just going to talk about high-path AI and kind of how to report sick birds or dead birds here in Ontario. And I just want to give an overall update on what's been going on with H5N1 in Ontario for the past few years. So just to give you a background of what we saw at the CWHC, so the spring of 2022 is when we first saw this virus hit Ontario, and we had quite a few cases in a vast array of species, most severely affecting Canada geese, bald eagles, turkey vultures, crows, and some other raptors as well. In the spring of 2022, it was pretty much spread across all of southern Ontario, as well as different areas of northwestern Ontario and eastern Ontario as well. And we saw a very similar thing happening in the spring of 2023 during that migratory period. But the difference was the geographical range was quite distinct, where we had most of our mortality events in the GTA. So for whatever reason, there were Canada geese that missed the first wave of this virus in 2022 and seemed to get hit hard by it in 2023. When I looked at the fall migration period in 2022, we had quite a few cases, not as high as the spring, but still quite high. And a lot of that was driven by some snow geese that were moving, especially through eastern Ontario. We had some mass mortality events in them. In 2023, things were looking better. We started to get fewer cases in the fall, so less than 20 total cases up until the end of January. Some of that was a scattering of snow geese, again, moving through eastern Ontario, much fewer than the previous year, as well as some tundra swans coming through the St. Clair National Wildlife Area. And then we had a scattering of Canada geese that were affected by this as well. So things were looking good for us up until the end of January. And I have that as a time point because that's when pretty much everything kind of happened at once and we weren't expecting it. So we had this large mortality event in the Kingston area with over 100 Canada geese that had died from this H5N1 outbreak. This was unusual because it wasn't associated with a migratory period. So typically we see it during spring migration or fall migration, the numbers increase. In this case, it was in the middle of winter when we weren't seeing any sort of migration happening at that time. And it wasn't just Kingston that was hit. We were seeing other mortality events, smaller. Some were only a handful of geese, some were larger numbers, like a couple dozen in different areas of Southern Ontario. And then kind of more Eastern Ontario, we were seeing some crows as well. Some of that was associated with the outbreak in the Canada geese, but we were also seeing cases in Ottawa and Cornwall that weren't associated with waterfowl deaths. One of the thoughts with this for the Canada geese, especially in the Kingston area, was we did have a cold snap at that time a few weeks prior. So there was question as to whether or not these birds were huddling closer together, whether they were stressed, which may have affected their immune system. So those may have factored into easier spread of the virus and then more disease related to the virus. After that, things quieted down, thankfully, and we actually went back to somewhat normal. We had a scattering of cases up until early April. And that's typically when our peak was for 2022 and 2023 was kind of early to mid-April, maybe into the end of April in 2022. But realistically, a lot more cases were showing up kind of around that time frame. And that's when we actually saw cases stop completely. So we actually haven't had a case of H5N1 since that time. And I'll show you the dashboard in a minute to show you kind of how to manage looking at that and what is posted there. But the thing I want you to know too is that just because we're not seeing wildlife dying from it at this time, it doesn't mean it's not still out there. We know that it is still circulating in birds. Ducks are still and geese are still testing positive from live testing. So we do know that the virus is still circulating. So there is still a danger to our domestic poultry. So this is probably your best source for how to find out about cases in Canada, and you can look specifically in Ontario. So I'm going to swap over to that website here. And what this website is showing you is basically all of the cases that have been diagnosed in both domestic poultry and in wildlife. So if you look on the map, there's a smattering of red and orange circles, and that is the wildlife specific cases. And then if you look at the blue and green, that is the domestic species. So what I'll often do is, because I'm only interested in the birds themselves. Oh, is there an issue, Charlotte?
No, we're just still looking at the PowerPoint and not at the website.
Okay. Don't know why that is happening. Still the PowerPoint. Okay, let me just see if this will pop it up. Is that popping up the website yet or no?
Doesn't seem to be.
Okay, let me stop screen sharing and start again. Okay. Let's pop that up. Is that better?
That's it. Thank you.
Perfect. All right, so on this website, now that you can actually see it, what I tend to do here is, because I'm looking at wildlife, I will pull down these layers here and just click off the poultry and non-poultry, just because I'm going to want to look at the wildlife cases. And now you can see it's just the red and the orange that are showing up there. And if you want to look specifically for Ontario, there is this little colored wheel at the side here. And you can click in Ontario, and now it will just show all of the cases in Ontario, so you can see on the map. And this is just going to be everything that we've diagnosed from the start. But if you see below that map, there are these other, this table here, and you can now start to click on those to see where they are. So if you look at this table, you can see the strain here is H5N1. So that is the last animal that we had. So this was a common loon, and you can see it was in the Lake Erie area here. So you can actually go looking at those cases to see where the most recent case was. And we have had some avian influenza cases pop up. So this was a ring-billed gull that was more in the Georgian Bay area. I don't see it on the map, so let me pull up this other one. So these gulls were basically animals that were infected with avian influenza, and I don't see them popping up on the map there, but you can see the strain here is H13N6, and that's a low pathogenic strain. So that's why they're showing up there, but they're not a high path strain, so that's probably why they're not popping up on the map specifically. But if you click on the high path ones, that common loon, and then there's a crow, and you can see that they pop up on the map. So if I just pop back to my PowerPoint, so that is a dashboard that you can utilize to look at what's going on with avian influenza. So the question often comes up, who do you contact with sick or dead birds? So when it comes to sick birds, the first thing I will mention is please don't contact us at CWHC first. We are happy to take reports. So we do like to track things like neurological birds that are sick. That is good for us to know because that can help us track things like avian influenza, West Nile virus. Cervids like deer are good to know because those are ones that the Ministry of Natural Resources is interested in. And then songbirds that are by bird feeders. So if there is a bird feeder disease, that's another thing that we like to hear about as well, because that can help us track things like salmonella or mycoplasma, a few different bird feeder diseases there. But if you are looking for assistance, and many of you may already know of wildlife rehabilitators in your area, but there are a couple areas that you can look to find out where they're present. So Toronto Wildlife actually has a map on their website, so I won't click the link because I have a picture of it here. But you can see that they've kind of mapped out where different wildlife rehabilitation centers are across the province. So you can quickly find out, is there one in your area there? And then if I flip back to my website here, I'll just click on, this is the ontario.ca page. And if you just Google wildlife rehabilitator in Ontario, you should find this quite quickly. So this will give you some information about wildlife rehabilitation centers. And then if you scroll down, it'll talk about a list of authorized wildlife rehabilitators. And then you can click on that and that'll bring up this table that gives you all of the authorized wildlife rehabilitators in different areas. So you can go find your district and your area and find out what wildlife rehabilitators are there. The other thing I'll mention to you is that they have a list here of abbreviations, and those are the types of animals that those rehabilitators are going to be able to handle. So if you have something like a bat, you're going to want to look for a rabies vector species because not all rehabilitators are going to be able to handle bats. Same with birds, whether it's a raptor or other birds. So you want to make sure that you're contacting the appropriate wildlife rehabilitator, and realistically just reaching out to them, they'll be able to help you, and they may have others to suggest for you. And then the last thing that I just wanted to mention was that if you do have a dead animal that you want to send for testing, or if you are planning on euthanizing the animal, then you can definitely reach out to us at the CWHC. All of our contact information should be up there for you now. We do have a toll-free number, an email that you can send to us. Those are probably the two easiest ways to contact us. You can also do online reporting. That is something that if it's not a rush, then the online reporting is a little bit better to do, just because that's the last thing that we check, and it does take us sometimes a day or two to get back to people for that. But usually with the call or the email, we can get back to you relatively quickly. And if you do have questions, definitely reach out to us earlier rather than later. What we do with some municipalities is that they will collect a few things, and then what they'll do is after a week or two, they'll just kind of have a group of animals in their freezer, and they will reach out to us and say, hey, these are the animals that we have. Are you interested in bringing these ones in? This is what we're worried about. And then we can kind of discuss with you where to go from there. So I'll stop sharing there, and I'll be on at the end to answer any questions you have.
That's awesome. So many great resources out there, but sometimes if you don't know that they're there, you don't know who to reach out to, and then it can be very frustrating. So we'll keep those on the screen share for a while when we've got this backup and recording, and then you'll have all those resources available. Thanks again, Brian. Our next speaker is from the Ministry of Health, and Dr. Heather McClinchey is here to talk to us about zoonotic disease, which is a bit of a concern when we're out there with wildlife and or domestic birds. Thank you again for joining us, Heather.
My pleasure. Thank you very much for inviting me. So Charlotte said, I'm Heather McClinchey. I'm a public health veterinarian in the Office of the Chief Medical Officer of Health. I have the distinction of being the only veterinarian at the Ministry of Health, and I have a wonderful and diverse job. Most of my portfolio is zoonotic diseases, and I provide counsel to my colleagues within the ministry. I also help public health units, and I also work across many different ministries and organizations like the Canadian Wildlife Health Cooperative. So I have the pleasure of working with Brian on a fairly regular basis. So today I thought I would talk about zoonotic disease risks and just make sure that everybody's on the same page and understanding what these are, what are reportable diseases, the role of public health units. And then I thought I'd take the opportunity to talk about some disease examples, kind of like what's in the news right now. And I think my presentation actually is going to complement Brian's very well as well. So this is great. So zoonotic diseases are diseases that are diseases. These can be bacteria, they can be viruses, they can be fungi, they can be other agents like prions, which are proteins that cause mad cow disease, and they can transmit from animals to people. And this can happen in a number of different ways. And there's a picture here on the screen that shows this very nicely. These can be directly transmitted from animals. They can be transmitted through vectors like mosquitoes, ticks, or other insects. They can be from direct contacts, bites, foodborne illness, or contamination of the environment. We are concerned, some zoonotic diseases cause no clinical signs or very mild clinical signs. Some can be very, very severe. Some can even cause death. And on the public health side, we typically focus on those diseases that have serious outcomes in animals or people. They may also have trade implications. They may also be agents of bioterrorism. So there's a select group of diseases which we focus on in public health, but certainly not all of them. I thought I would take in a moment here just to make sure that everybody understands the role of public health units. And I had a very long slide. It's still very long, but I have condensed it because the public health units, of which there are 34 in Ontario, have a varied role in looking after the health of Ontarians. These can be from health promotion, school vaccine clinics, health education. But they also have a really important role in zoonotic disease situations as well, both from the animal and human side. And Ontario is very unique this way that we have some animal diseases that are directly reportable to public health, meaning that they don't go through the pathway of being reported to our agricultural ministries, but they come directly to public health. And this will we will find that they have to do investigations of these diseases and appropriate follow-up for human contacts. On the human side, sometimes we're presented with zoonotic disease in humans, and we have to find out what the source is. And so sometimes that that involves our colleagues on animal or wildlife health, or colleagues at Canadian Wildlife Health Services. So like I had mentioned, Ontario is very unique that we have, through the Health Protection and Promotion Act, direct reporting of certain animal diseases. These are rabies, avian chlamydiosis, which was also known as psittacosis, Echinococcus multiocularis, and influenza. So these are animal influenzas of bird, pig, or novel case species. So this could be like a new species in a dog, or a new species of influenza in a horse. And then on the human side, we have a whole pile of different diseases that are reportable to public health. This is actually just a few of them, believe it or not. And I've just listed some of these that can come from animal origin and may involve some sort of animal investigation as part of them. In the future, we are going to be adding, I think, more to our disease in animals, just because of the changing landscape, and we want to make sure that we identify very risky diseases in animals immediately. Today, I'm actually not going to talk about the big elephant in the room, which is salmonella. That is by far the greatest risk from backyard chickens. The Public Health Ontario has a lovely, lovely resource available to the public on their website. And it really talks about some biosecurity and protections for the birds and protections for the people. And I really would encourage you to share this with your with members of the public, or share this with your municipal governments if they're looking at trying to put some guidance together about for backyard flock program in your area. I am going to talk about avian influenza, but a little bit different aspect of it than Brian was speaking of. So like Brian mentioned, we have had this latest panzootic, which has been circulating in North America since December 2021. And since the spring of 2022, it's been pretty consuming of our time and interest. In Canada, on the domestic poultry side, there has been 420 infected premises. These are commercial and backyard flocks, 48 of which have been in Ontario. And in Canada, we've lost in excess of 11 million birds to this disease. Sorry, commercial birds and backyard flocks. In the US, the situation is a lot different. They have a lot larger farms in the United States, and they have lost over 100 million poultry from 1,173 flocks, and that was as of 2 days ago. 665 of which were backyard, and some of the commercial flocks are just, boggles your mind how big these some of these premises are, and they can lose millions in one flock. In March of 2024, a new strain called B3.13 emerged. This is also known as the dairy cow strain. It's been infecting dairy cattle and is believed to have originated from one single wild bird to cattle transmission event, probably back in December or November of 2023. It has now, this disease has spread to 14 to herds in 14 states. And we've had a number of different mammals and poultry impacted from this strain. We thankfully don't have this in Canada yet. It is a concern though, because there are some large dairy shows coming up in the fall, both in Canada and the US, and it's very common for cattle to move across the border to these events. And so we are, the Canadian Food Inspection Agency is putting some rules in place to try and prevent this from coming into Canada. In the States, they have documented cattle to cattle transmission. They have documented cattle to poultry. cattle to mammals. So things like barn cats, rats, mice have been impacted. And they've also had cattle to human and poultry to human transmission of this B3.13 strain. It seems to have an easier time moving to humans, and which is of concern for us. I do think it's worth mentioning that in the United States, there have been underreporting of cattle and human cases. This is a complicated situation in the States. It's different than poultry. In poultry, the disease is highly fatal and very rapidly in most species. So it's not like you can really hide when you have 1 million dead birds on your property. But the cattle are only getting sick, and most are recovering. So the reporting of this has not always been clear. So I think we have to take the numbers out of the United States with a bit of grain of salt. On the bottom right of the screen here, you're going to see some interesting information about some mammals that have been diagnosed in the US. Many of these have also been diagnosed in Canada. On the information that the wild bird link, they're also in Canada. There's also information on some of our mammal cases as well that we have seen. So certainly a disease that with a really, really broad reach. From a public health perspective, the risk to the public is low to very low. But occupational risks to people that handle birds on a regular basis is considered low to moderate. And the same with potentially impacted mammalian species as well. We have industry-specific recommendations, and that would go for municipalities as well. We have them on the Ministry of Health website and Public Health Agency of Canada. We have on the ministry website, we have some personal protective equipment recommendations for people that are handling wild birds, poultry, and mammals as well. Brian's already gone through how the reporting pathway for dead wildlife and sick wildlife. Good hand hygiene measures are always important, both for backyard flocks and for anybody who's been touching poultry. We want the public to know that consuming poultry and red meats that are cooked properly is completely safe. It's amazing what agents can be killed by proper cooking. If I could get one message through to pet owners, it would be, please don't feed raw meat to your pets, even if it's human grade meat, because that human grade meat does not mean that it is free of bacteria or other diseases. We want to make sure that food preparation surfaces are cleaned thoroughly after use. The other message we want to get through is we don't want people consuming raw milk or raw milk cheeses, especially those from infected animals. Pasteurized milk products do appear to be safe from all of the research that's been done. We want to make sure we don't transmit virus from one property to another, one park to another. So you do want to make sure your footwear is clean when you're moving between those locations. And then my last point, we do recommend, highly recommend that anybody who is dealing with animals on a regular basis receive their seasonal flu shot. These are going to be available to all Ontarians by the end of October. Put some resources up on the screen here. This presentation can be shared afterwards if you want more information. I thought I would take the opportunity here to just mention about rabies. Rabies doesn't affect birds, thankfully. It only affects mammals. But we do want to talk about this because we have had a recent human case in Brant County that occurred from a direct exposure to a bat. In Canada, we have raccoon strain, fox strain, skunk strain, and bat strain of rabies. These are our reservoir species in Canada, but that doesn't mean that they are the only species that can be infected with these viruses. Like I mentioned, it's any mammal can potentially be infected. And we do recognize that the risk of rabies varies by location. There are maps available to show you where those higher risk terrestrial rabies locations are, but we do want to make sure that everybody understands that any bat from any location in Canada could pose a risk to rabies. And just because a bat hasn't been found in that area doesn't mean that it's not a risk. So for backyard poultry and for parks that are where wild birds are congregating, we do want to prevent wild animals from entering barns and homes. We want to contain waste appropriately to prevent scavenging animals from seeking out those locations and hovering around them. For pets and wild stock, we want to get them vaccinated for rabies. Brian's already mentioned about where to report sick and dead wild animals. And if you have been bitten or scratched by a mammal or have had a direct contact with a bat, that is bat to skin contact, you want to make sure you wash that area very, very well with warm water and soap, copious amounts. I don't think you can use too much. And then you want to call a healthcare provider or go to your local hospital right away. The healthcare provider, in consultation with the local public health unit, will make a risk assessment and depending on the situation, may offer vaccines to you. If you don't have the ability to seek health care or you're not near a hospital, you can always call your local public health unit and they can walk you through the risk assessment process. So just some key takeaways. We want to make sure that you understand that rabies virus is transmitted by saliva and neural tissue. It cannot be transmitted by blood, urine, or feces. Human rabies vaccines go in the arm now, not in the stomach. I know this is a common misconception, and it's why many people will not seek out care for bites or scratches or interactions with bats. Public health units don't want to euthanize animals, domestic animals, to test them for rabies. They will only do this if they are clinically showing signs of rabies and under direction by a veterinarian. 99.9% of the time, they are going to want to observe those animals, meaning they just want to make sure that they stay healthy for 10 to 14 days, and that depends on the species. If they don't get sick within that period of time, no vaccines are required, no action of the animal is required, and everybody happily goes on their way. And that, for most rabies exposures, that's the pathway that we take. For wild animals, it's a little bit different. If they are available for testing, they will be tested to rule out disease. And that's for reservoir species of wild animals. So that's bats, raccoons, skunks, and foxes. Other wild animals, it's on a case-by-case basis. So if they're at a wildlife rehab center and it's, I'm trying to think, if it's a possum that bit somebody, we probably would just put them under an observation and not test them. Early healthcare interventions are almost 100% effective at preventing disease. So for that reason, we don't want people to ignore direct contact with bats or bite or saliva contaminated scratch from a species capable of carrying rabies. Rabies vaccines for domestic animals are inexpensive and are a very effective way at preventing disease, and they are required by law in Ontario. And if you go and check out our link here, you will see what species are required to be vaccinated. It's not all of them, but it's a vast majority of them. And then very quickly, just to finish up, vector-borne diseases are also in the news right now, particularly West Nile virus and Eastern equine encephalitis. These are viruses. They are transmitted by mosquitoes. Birds, horses, and people are capable of getting sick and sometimes dying from these diseases. People do not get are not at a risk from the horses or birds directly. They have to be bitten by the mosquito. So we use birds and horses as sentinels or to tell us where the virus is in the province. Eastern equine encephalitis has been quite extensively located right now in the eastern part of the province. West Nile virus, a little bit more diverse in its distribution across the province. The impact on birds and poultry does depend on the virus, and it depends on the species as well. In humans who get infected by West Nile virus and Eastern equine encephalitis, they can have no disease in some people. They can have mild disease, they can have severe disease, and unfortunately, some cases have been fatal. And we've seen that already in the province this season. For some species of birds and horses, there are vaccines available for these diseases. Unfortunately, for people, there are not. So our only protection is to protect ourselves from mosquito bites. And the best thing you can do is try and eliminate mosquito breeding habitats, so standing water from your property, to try and reduce the number of mosquitoes on your property. And that's the end of my presentation. Happy to take any questions at the end if anybody has any.
Thank you so much, Heather. There is a lot of disease out there, and although our poultry might not get infected with the rabies, I'm sure municipal officers love having a few extra resources so they know where the tracking is. But again, how to deal with it, especially if you are far away from the hospital. I didn't love hearing that the B.3.13 strain of high path AI is definitely having some different mutations than we expected, but better to know and be extra safe, whether it's poultry or dairy or other animals that we're coming in contact with, that it could be out there. So thank you again for sharing. Now we're going to move from some scary topics to some good news stories. Mike Hutchinson from the municipality of Georgina has been kind enough to join us today. We met, I think, during COVID and had the chance for PIC to help with his urban hen project. So Mike, I thank you for joining us. This was by far the most requested topic. I will just mention that there are no questions in our Q&A right now. So if there are no questions, we will just promptly wrap up. But if you have questions for Mike or any of our speakers, use that Q&A function at the bottom and tell us what you need to know. Thanks again for joining us, Mike. I'll let you take it over from here.
Thank you, Charlotte, and thank you for having me here this morning. I don't have any slides to present, so you're just going to have to look at me for my entire presentation. So, as Charlotte mentioned, my name is Mike Hutchinson. I am the manager of municipal law enforcement for the town of Georgina. I've worked for the municipality since 2004, starting as a seasonal parking control officer and working my way up to the manager position approximately 6 years ago. During my time with the municipality, I've seen many new bylaws and policies enacted by the municipality, including the Urban Hens program. So I'll just give a brief history of the evolution of urban hens in the town of Georgina, which resulted in the Urban Hens licensing bylaw. In 2016, after the Municipal Law Enforcement Division proceeded with enforcement against a resident for keeping urban hens in a residential area, the resident made a deputation to council with a petition from other residents asking to allow urban hens to be kept in residential areas of the town of Georgina. Some years passed, and in 2019, Council directed staff to begin a consultation process to better understand the issues and attitudes of residents about allowing urban hens. On November 27th, 2019, following the results of the consultation process, Council received a staff report and approved the recommendation to enact a bylaw for a 24-month pilot project that received applications from residents across town that would allow a maximum of 3 urban hen licenses per ward, and there are 5 wards in the town of Georgina. Also, within these wards, there would have to be a 100-meter separation distance between license holders, and all applicants were required to attend a mandatory educational session, which was held in conjunction with the Poultry Industry Council. The applicants were responsible for all of the costs, and we had a large number of residents sign up for the training. Council also approved a recommendation to amend the exotic animal bylaw to recognize the implementation of a pilot project. During the course of the pilot project, the Municipal Law Enforcement Division only received one complaint, and upon investigation, the concerns were unfounded. On March 30th, 2022, Council received a staff report and approved the staff recommendation to make the Urban Hens bylaw permanent. Staff brought forward bylaw amendments to make the program permanent. In Georgina, once an application and fee is received, an officer will attend the applicant's property to confirm that the chicken coop sizing, setbacks, and construction meet the requirements of the bylaw. If the applicant meets all of the requirements of the bylaw, then a license may be granted. Some of the unique requirements in the town of Georgina's Urban Hens bylaw include that applicants must review mandatory educational materials, including materials from the Canadian Food Inspection Agency, OMAFRA, and the Ministry of Health. In the bylaw, it says that the educational requirements can be updated by the town at any time. So Charlotte or any of the other presenters, if you have any relevant materials that we should be sharing, please send them to me after the presentation. In Georgina, there is also a one-time $100 licensing fee. Each license holder may have a maximum of 4 hens. As mentioned earlier, there is a 100-meter separation distance required between license holders. So if your immediate neighbor or even a neighbor a few houses down have a license, you are really out of luck. You will not be able to legally have urban hens in Georgina. The licensing fee and application is a one-time item in Georgina, and renewals are not required. However, the town of Georgina has the authority to revoke a license for non-compliance at any time. In Georgina, a lot size of 0.4 hectares is required to own hens in a residential area, which is approximately 1 acre. This is kind of funny because I live on a typical subdivision lot in Georgina, and I always thought that one day I might be able to get some hens. When I did the math last night in preparation for this presentation, I realized that my lot is about 0.1 acres. So I will never be allowed to have urban hens if I continue to live at my current location. Finally, in the town of Georgina, hen coops and runs must comply with the zoning bylaw provisions for structures. So the urban hens licensing program has been very successful in Georgina. And one reason why I think it has been so successful is that we have high standards that license holders must follow. The municipality and the applicants / license holders must be transparent with each other. As previously mentioned, an officer will inspect the property before a license is issued, and the applicant must provide a site plan showing the location of all lot lines, structures, and the location of the chicken coop or run. Once the license is issued, if the Municipal Law Enforcement Division receives a complaint, an officer is dispatched to the property within a day or two to conduct an inspection. I can honestly tell you that the majority of the complaints we receive are completely unfounded. One consistent complaint we receive from local residents is that there are rats. And to be clear, when I say rats, I'm talking about the animals, not the people that are complaining. I'm sorry, I had to say that, but you may or may not be aware, but there are high levels of rats in communities across the Greater Toronto Area and the province. People automatically want to blame the rats on the chickens, but when officers attend the properties and the coop and the run are spotless, and the fertilizer and the feed are all being stored correctly, it is hard to blame the rats on the chickens. It really is just a fact of life with all the development occurring around us. To satisfy complainants, officers will conduct several random inspections, and advise the complainants that the chickens are not attracting the rodents. Most of the hen owners are very compliant as they have invested money constructing their coops and runs and obtaining their hens. They want to do everything they can to keep their license. In a lot of cases, these hens actually become part of the family. Officers are committed to ensuring hen owners are following the rules. In preparation for this webinar, Charlotte asked me to provide some specific success stories in Georgina, but I honestly cannot pinpoint one. The entire program has been a great success story because of the commitment of the license holders and the staff administering the program on behalf of the municipality. In case you are wondering, we have 30 license holders in Georgina and a population of 50,000 residents. If each license holder has the maximum amount of hens permitted, that is only 120 urban hens within our urban areas of the town. If you know the town of Georgina, you will know that we are home to a large rural area as well, which means that there may actually be more hens in the town of Georgina than humans. I don't know for sure, but that is something for me to look into later on. Before I finish, I want to talk about a recent story I read about online from the town of Clarington. And I apologize if there is anyone here from Clarington. Their municipal council recently voted to reject urban hens in their municipality by a 4-3 margin. I found that shocking because I hear that most municipalities in Ontario with an urban hen program are very successful. One councillor from Clarington was quoted as saying, "We cannot trust that the residents will follow the rules." And I completely disagree with that because here in Georgina, the urban hen license holders are following the rules. If people are not following the rules, it is the role of the municipal law enforcement division to hold them accountable. And if we are worried about people not following the rules, we would have to ban everything in our communities, including cars. So please, I say give urban hens a chance. And on that note, it brings me to the end of the story about urban hens in the town of Georgina. And I do look forward to any questions that anyone might have following the presentation. Thank you.
Mike, that was a great presentation, and I love the Give Urban Hens a Chance wrap up there. We do have some questions that have popped in, so I'm going to invite all of my presenters to turn the cameras back on, join me on screen, and we'll have these discussions. Mike, I'm afraid you're up first with the specific type of questions that they're looking for answers to. But if anyone knows what's done in other places, please feel free to share. The first one says, what does the township do with roosters who are hatched? Does the local humane society take them, or does the city take responsibility for them?
Well, I can be completely honest with you. I've not heard of that happening in the town of Georgina. However, roosters are strictly prohibited under our urban hens bylaw, of course. We do occasionally get complaints about roosters on properties, and it's funny how the owner of the rooster never thinks it's a problem, but it is driving other residents crazy, if you can imagine, at all hours of the day. So typically when we do come across a rooster on a residential property, they are not an urban hens license holder because the license holders know the bylaw and they are aware that they cannot have one. So I truthfully don't know what happens to the rooster, but in some cases, I have heard of officers recommending that they drop the rooster off to a local farmer. However, I do understand there could be biohazards involved with that. So I would check with maybe with OMAFRA before anyone does anything like that.
Agreed. And yes, that commingling and quarantine for isolation when a new bird enters your flock would all be steps that they'd want to consider before accepting a rooster from someone. But all the better reason to get your chicks sexed or start with those ready to lay ladies, the pullets who are ready to go and guaranteed to be female. Heather, feel free to just jump in.
Yeah, I was just going to say, if you set up your municipal bylaw to disallow roosters on site with the laying ladies, you won't have any fertilized eggs produced, so you won't have chicks to worry about, and you won't have either female chicks or male chicks, because there won't be any chicks. These will just be table eggs. So that is a great way that a lot of municipalities have eliminated that worry.
I think it furthers the point too, Mike, that the people with the license understand the bylaw. You guys really went into this cautiously and with a lot of forefront thinking of education, so they know what they're allowed to have and how to get what they need. We are running out of time, but I've got 3 more questions for you. I'll start with we'll stay on the bird livestock questions. Are there rules to quote unquote retiring a hen if she's no longer laying? Can the owner, now they've said kill the chicken, but they could euthanize the bird, or must it be humanely euthanized? I think they're implying by a veterinarian.
Is this question for me, Charlotte?
I think it's mainly aimed at what Georgina's
Okay.
recommendation is.
So we do have a provision in our bylaw that the home slaughter of hens is strictly prohibited. And I'm just reading from the bylaw right now. It says that deceased hens must be disposed of at a livestock disposal facility through the services of a veterinarian or through a facility as approved by the Ministry of Agricultural, Food, and Rural Affairs, and disposed of in accordance with all laws. So you cannot kill the animal at your home in a residential area, but there are facilities available where you can take the animal if you would like to, or you keep it as a pet.
Agreed. I refer to them as the end of lay ladies. And to your point, these birds do become pets at some point. And a lot of times, even though they're no longer in lay, you have the license for them and you want to keep them because they are like any other pet that you keep. You keep them because they bring you joy, not necessarily because you're getting eggs from them every day. For Georgina, they have another question. There's a lot of questions about how your municipality rolled this bylaw out. We're going to go to cost. And the question here, I did a Northern Poultry Tour, and this was a common question in Northern municipalities considering a bylaw as well, because budgets are tight. What is the, and we'll say estimated annual cost for the town with bylaw officers inspecting and responding to complaints?
So as mentioned, our project became permanent in 2022. We only have 30 license holders, so I would suggest that the cost to the municipal law enforcement division is quite minimal. We have a large licensing regime in the town of Georgina for many different types of businesses. So this just kind of falls under that licensing regime. So, in the couple of years, almost 3 years that we've had the program, only 30 properties have been inspected. So it's certainly not costing us a lot of money. However, there is a one-time fee because obviously we do have a licensing coordinator that has to process these applications and answer any inquiries from residents. So there is a $100 licensing fee. It is a one-time fee, and we do not inspect. After the initial inspection, we do not inspect a property again unless we receive a complaint. And the complaints have been few and far between. As mentioned, they are typically unfounded, so officers do not have to spend a lot of time on the property. And I would say that there is not a great expense for the Urban Hens licensing program for the town of Georgina.
I love that, although your version of great expense and mine might be different working at a charity organization. But that being said, I hope everyone, the last few comments in our Q&A are things like, thank you very much. So thank you to all of my speakers. It has been very helpful. People have had their questions answered. There is someone who said that their municipality is considering these questions, and they're hoping that we, by providing answers, can help everyone make improvement and the betterment to their, not only their chickens, but probably the people living in the area. Again, as Mike mentioned, it wasn't the license holders. And a lot of the questions or the complaints that come in and trigger a response were the people who didn't have a license. And that is still going to happen whether you have a bylaw permitting or not. So might be a consideration. Write those municipal bylaws carefully, as Georgina did, and you too could find success. I want to thank Brian for helping us remember that wild birds can get sick, but there's someone to call, as well as how to monitor how dense the illness is in your area. Heather for keeping us and our other pets safe as well, because zoonotic disease is a problem. And Mike for sharing your success story with us. I hope everyone who is engaging in small flocks or urban hens is able to move forward with success as well. With that, we're going to end the webinar, and we thank all of our attendees for joining as well. I hope you have a great day.